Okay, everybody. My topic today is going to be successful counseling. So, what I'm going to do is I'm going to provide information on tools that we can use to be successful counselors. One of the things I want to say is one should have a true care and concern. Without a true care and concern, there's no need, in my opinion, there's no need to do any counseling. So let's start there. We're going to start with having a true care and concern for individuals that need counseling. Now, you have a variety of counseling areas. You have married counselors, you have substance abuse counselors, you have group counselors, and there's a few others. So, in my opinion, there's just the one ingredient that one need to be successful as a counselor. And again, the first ingredient is to have a true care and concern for the individuals or the patients that you are going to service. The second thing is, if you will, make sure you have information from the ACA Code of Ethics. And there's also the APA Code of Ethics if you want to look any further into how a counselor should conduct themselves or a psychiatrist. Okay? So as you can see, this is from 2014, the ACA Code of Ethics. If you look on the first page of the Code of Ethics, you will see that we have their mission statement, and then you have the table of contents. And as you go along some more, then you have the preamble, and then you have the purpose, Code of Ethic purpose, which the Code of Ethic purpose is to protect the patient as well as the counselor. That's what the purpose is. And if you go through the sections and you look through each section, you will see a section. For instance, I highlighted this one, and this is I don't know if you can see it. Maybe I'll bring it a little bit closer. But this states client's welfare. And this one here, avoiding all harm. Avoiding harm. Which means avoid harming the patient or harming the client. And their welfare should be at the top of the list of that counselor's mission. And when you have sessions, it is also very good information to use motivational interviewing, which consists of empowering the client, making sure that the session stays about the client as well. So motivational interviewing is also good to use. And if I can provide any more information from my own experiences, would be to always stay humble, always remain receptive to new information, and never take it personal. Never take the patient's or the client's attitude or behavior personal. You can't take it personal. If you take it personal, then the session will definitely become unsuccessful and the session will become about you. So here's some of the ingredients in order to be a successful counselor. Have a true care and concern. Make sure you always carry yourself professional and in an ethical way. Make sure you keep your boundaries. You must keep boundaries. It is not good to accept things from the patient, and it's not good for you to provide anything to the patient. Showing no favoritism. But don't get not showing favoritism mixed up with that one-way treatment for all either. Because there is no one-way treatment for all. Each patient and each client that comes into you are different. Each and every one of them are different. And if you can, please do not use the one-way approach. That's in general in life, which I've seen a lot of people fail doing that. They approach everybody the same. For example, you will have some individual who you never met before, and you and that individual engage into a conversation. This individual is just touching and touching and touching and putting their hands on you while they're talking, and they do that to everybody. and that's not good social skills, and it's not a good thing to do. You must allow that person to get to know you and everything. So you should not, and the same thing with counselors. Counselors should not be putting their hands on the patients and treating all the patients the same. Okay, that is going to come to a dead end. That counseling career will come to a dead end if one does that. You must meet the patients where they're at. One-on-one, meet them where they're at. Allow them to talk. You must use active listening, which is from motivational interviewing. Use active listening. Do some summarizing, rephrasing to make sure and let that patient know that you're listening to them, that you're hearing them out. And at the same time, also always continue to gain training, to seek training. Training is always good. And if there's ever a question or something, an answer that you don't understand or you don't need, seek supervision. That's what supervisors are there for. And if you do those things, I believe that your counseling career will be successful. Always remember, it's about the patient. It's not about you. Okay. Stop it.